Something that is vitally important to know that most people don't is how to obtain vital signs. Today, Megan is here to volunteer so I can show you guys how to do vital signs. The first things we're going to need are materials. I have this little contraption. It's got everything I need. We're going to need a thermometer for your temperature, an oximeter for your pulse and oxygen, a watch to watch respirations, and a blood pressure cuff with a stethoscope to watch blood pressure. So I'm actually going to show you how to do vital signs. So you're going to want to go in the order of TPORBP, temperature, oxygen, pulse, respirations, and then blood pressure. So starting off with temperature, we have this probe, and you're going to want to stick a cover on it. And we're going to stick it under Megan's tongue. When you do it orally, you're going to want to make sure that the person hasn't drinking anything in the past 15 minutes, hot or cold, because this could affect their temperature. Megan's temperature is 98.0. A healthy temperature runs anywhere between 97.9 to 99.1. Next, we're going to check Megan's pulse and oxygen. This oximeter can go on the middle finger or the index finger, and it's going to check her oxygen percent and her pulse. If Megan's pulse did not look correct, we could check it manually by sticking our pointer finger and our index finger right here on her wrist and counting for a minute. Looks like Megan's oxygen is 100 and her pulse runs about 85. A healthy pulse goes anywhere between 60 to 100, and then healthy oxygen runs anywhere between 88% to 100%. Finally, we're going to watch Megan's respirations. Unfortunately, I don't have a watch with me right now, so I can't count her respirations. But when you were doing respirations, you were going to make sure you want to do it when they have their oximeter on. If you tell somebody that you're doing their respirations, they're going to start their breathing patterns differently, and it's not going to be accurate. If you have trouble seeing somebody's chest rise as you're doing their respirations, you can take your stethoscope and listen to their lungs in the back. This is an easy way to count respirations without letting the person know. A healthy respiration runs anywhere between 12 to 18 respirations per minute. And finally, we're going to do blood pressure. The first thing is I'm going to have Megan extend her arm all the way out. Today, Megan's wearing a short sleeve because if she was wearing a long sleeve, then this would not be accurate. You're going to want to feel for a pulse right here in the crease of her elbow. After I feel Megan's pulse, which is right here, on the blood pressure cuff, there's a little artery. I'm going to stick it about 1 inch above the artery and strap it on. You want to make sure that it's tight enough to stay on, but not too tight that it's already suffocating their arm. Next, I'm going to stick on my stethoscope. You want to make sure that you can still hear the heartbeat with the stethoscope. You want to close the valve all the way and pump up to about 200. Open the valve really carefully and slowly, and listen for your first heartbeat. My reading of Megan's blood pressure was 102/78. You want to open the valve all the way and let all the air out. A healthy blood pressure runs anywhere between 90/60 to 120/80. So what do these numbers mean? Well, your top number is going to be your systolic number. That's the amount of pressure that is against your artery walls when your heart contracts the first time. So that first heartbeat you hear is going to be your systolic number. That's your top number. You're going to continue to hear heartbeats, and until your last heartbeat, that's going to be your diastolic number. That's the blood pressure that when your heart is in between beats. So Megan's last number was 78. Your blood pressure is how forceful your blood is against your artery walls. So when you're checking somebody's blood pressure, if it were to run high, get them a glass of water, make sure that they're resting, they're staying easy, because if they were up and getting moving, then they're going to continue to have high blood pressure. According to fireengineering.com, vital signs are an important component to patient care because they determine what treatment procedures to follow. They provide critical information or needing to make life-saving decisions. So today I showed you the materials that you're going to need for vital signs, how to actually obtain vital signs, and why it is beneficial to society.